Hi, my name is Deborah Miller, and the purpose of this presentation is to inform you about some of the alternative treatments for autism. According to the Centers for Disease Control, autism in 2007, autism affected 1 in 150 children. Out of that, 1 in 94 were boys. Autism is a spectrum disorder that is defined by certain behaviors that no two children will present as the same. Behaviors can be some of the following: difficulty in processing information, aggressive behavior, self-injurious behavior, tantrums, little or no eye contact, difficulty in socialization, uneven gross and fine motor skills, little or no communication, intestinal swelling, constipation, and seizures. Traditional therapies for autism are speech therapy, which involves much more than teaching a child how to pronounce words. Speech therapists work with nonverbal communication through teaching gestural communication or training with PECs, picture exchange cards. Electronic talking devices and other nonverbal communication tools are also used. A second one is occupational therapy, which includes life skills such as buttoning a shirt, brushing your teeth, or skills for handwriting. Other skills taught help in appropriate response to information coming through senses, which are done through interventions such as brushing, playing with balls, or swinging. A third is physical therapy, which helps with gross and fine motor skills by building or rebuilding strength. While many parents find these therapies to work, some turn to alternative therapies for extra support in controlling behaviors. Alternative therapies may be beneficial in the treatment of autism. Four of the alternative therapies are applied behavior analysis, or ABA, which teaches social, motor, and verbal behaviors as well as reasoning skills. This is done by administering clear instruction as to what the desired task should be and how it should be done. When the task is done correctly, a reward is given. The U.S. Surgeon General states that 30 years of research on ABA approach have shown very positive outcomes when ABA is used as an early intervention tool for autism. The research includes several landmark studies showing that about 50% of children with autism who were treated with ABA before the age of 4 had significant increases in IQ, verbal ability, and/or social functioning. Second is the gluten-free, casein-free diet, or GFCF diet, which eliminates all wheat and dairy products from the diet. By doing so, constipation, many cognitive and behavioral symptoms can be eliminated. This therapy must be a lifelong diet change in order to help the autistic child in being able to function on a daily basis.
How can I find out more about the gluten-free diet, and does it cost a lot?
Usually, the diet can be suggested by a pediatrician, found in books or on the web, or by searching for GFCF diet. The diet can be costly as it has to become a way of life for the child. Thank you. A third therapy is hippotherapy, which uses the movement of a horse while walking to improve balance, posture, mobility, and function, as well as psychological, cognitive, behavioral, and communicative functions in autistic people. Evidence provided in 2008 by Dr. Daniel Bluestone, a pediatric neurologist at the UC San Francisco, states, after following the progress of children receiving treatment by comparing MRI scans over time, he found that repetitive movement of writing prompts physical changes in the brain. We think hippotherapy is effective in helping rework networks within the cerebellum. The pathways within the brain that facilitate a particular movement become reinforced over time. The more pathways you reinforce, the better the brain compensates and the better motor function can improve. A fourth, music therapy, which uses musical instruments and songs to help in developing socialization, eye contact, cooperative social behaviors, as well as remediation of speech. Music therapy is done in a non-threatening nature after observation by a therapist. The child's needs are assessed and the activity or song is based on these needs. Musical games such as passing the ball back and forth to music or playing musical instruments can be used to foster socialization as well as eye contact. Research shows one 6-year-old echolalic child was taught speech by having the speech therapist sing simple question-answer phrases set to a familiar melody with full rhythmic and harmonic accompaniment. Later, the words were substituted for more meaningful words. When the music was eliminated completely, the child was able to verbalize the entire sentence in response to, "What is it and what is it doing?" These 4 therapies, as well as others, have helped many parents find results, but others may not find any change at all. 2 authors have shown through research that parents seem to be pleased with alternative treatments. According to Gordon in 2000 from the article A Neural Systems Perspective for Improving Behavioral Treatments for Autism, although a vast number of therapeutic approaches have been tried, it is generally agreed that only behavioral treatments have had success in improving skills. And a second view by Umbarger in 2007, stating in his article, State of Evidence Regarding Complementary and Alternative Medical Treatments for Autism Spectrum Disorders. Families who have children with autism spectrum disorders were found to resort to alternative medical interventions in high numbers. The vast majority of these therapies were biologically based, and families were overwhelmingly satisfied with the results. As you can see, these 2 authors have found alternative treatments to have been helpful to some families. The evidence shows that alternative treatments may eliminate behaviors in autism. I hope this has provided some insight on some of the alternative treatments for autism and aroused your curiosity to research more about alternative treatments or to suggest them to a parent of an autistic child. Are there any questions?
Can these therapies be administered at home, or does it have to be done by a doctor?
That's a very good question. Music therapy is taught by a certified music therapist, usually in a school setting or a center. For ABA, parents can obtain training for themselves, or it can be administered by a trained therapist, a doctor, or a doctor familiar in the therapy. Hippotherapy is done at a specialized horse riding arena. This therapy is done by registered therapists, physical, occupational, and speech therapists. Well, this concludes my presentation on alternative treatments for autism. Thank you for your time.